As you probably know, vitamin D3 is an essential nutrient that helps the body absorb calcium and maintain healthy bones. However, as we stated in the previous video, too much of a good thing can be a bad thing. So, overdue vitamin D3 can lead to toxicity and potentially harmful side effects, even life-threatening. Here are some of the common side effects of vitamin D3 overdose. Without vitamin D, calcium cannot function properly in your body. Therefore, most of the symptoms of vitamin D toxicity are related to hypercalcemia, which means excessively high calcium levels in your blood. Hypercalcemia can be life-threatening and requires immediate medical attention. Symptoms of hypercalcemia include high blood pressure and cardiovascular disease, kidney stones, kidney injury, and even kidney failure. Digestive distress, such as loss of appetite, vomiting, nausea, constipation, and stomach pain. Dr. Joanne E. Manson, the Michael and Lee Bell Professor of Women's Health at Harvard Medical School, says, "People often assume that if some is good, more is better. This is generally not the case, and certainly is not true of vitamin D. While there is no question that vitamin D and calcium are essential to bone health, it appears that very high doses of vitamin D don't provide further benefits for bone health and may have a harmful effect. As we just learned, the excessive calcium should be deposited in our bones instead of circulating in our bloodstream. In other words, the hypercalcemia can lead to a loss of bone density. Symptoms of this condition include brittle bones, fractures, bone cysts, abnormal gait, and bone pain. If you are experiencing any of these symptoms, it is important to seek medical attention immediately. Your healthcare provider can perform a blood test to determine if you have vitamin D3 toxicity and develop a treatment plan to address the symptoms. Your doctor will likely advise you to stop taking vitamin D supplements immediately. They may also recommend that you reduce the amount of calcium in your diet temporarily. In some cases, corticosteroids or bisphosphonates may suppress the release of calcium from your bones. The good news is that we can certainly avoid hypercalcemia taking vitamin K2 with vitamin D together to ensure the calcium transported by the vitamin D is absorbed by your bones where it's needed, rather than accumulating in deposits in your arteries. So, please check the description below and look for a link to a video on how to avoid hypercalcemia using vitamin K2. If you find this information interesting, please don't forget to like, subscribe, and comment, as I would love to hear your opinion.